Now our organism is Listeria Monocytogenes. This is also a gram-positive rod, and the particular feature about this is that it is also L and V shaped. Now, but the differentiating feature between diphtheria is that this organism is motile. Now, this is not very quite motile, but it has a tumbling like movement. Now, another special feature about this is that whenever this organism is cultured upon a blood agar, what it has some small narrow zone of beta hemolysis. That is one of the most differentiating features that differentiate this organism from diphtheria. Another thing is that it grows in cold temperatures, so meaning that refrigeration actually enhances its life. Now, this enhancement of life or its ability to survive in cold environments is known as cold enhancement. Now, the diseases that this organism causes is that in neonates it can cause meningitis and sepsis. So, meaning that it has a transplacental meaning that it can transverse from the placenta of a pregnant mother to a neonate. Now, the other thing that is can affect pregnant women. In the pregnant woman, it causes sepsis or asymptomatic features such as influenza. Now, this organism especially affects transplants patients, especially the patients who have received kidney transplant. In those patients, it causes meningitis as well as sepsis. Another disease that this organism is very profound of knowing in the food industry is it causes gastroenteritis. It is one of the organisms that can cause endemic gastritis. Now, the life cycle is that it is basically present in the soil and the plants. So whenever organisms or animals actually eat these, they become infected. So whenever a human receives their milk from this organism, or cheese or undercooked meat or raw vegetables from the plant sources, what they get is they get affected. Now, if the female is pregnant, so what will happen? She will obviously carry this disease because she is actually prone. So meaning that this disease is actually affecting those patients who are actually having immunocompromised states, such as neonates. They don't have their well immunized, but the mother do transfer there were some antibodies, but it's not against this specific organism, it's against a lot of different things. And pregnancy as an immunodeficient state, and transplant is also an immunodeficient state. This is quite well known, but it is another counterpart that it can also affect non-immunodeficient people. But immunodeficient, it can mostly prevalent in neonates, pregnant, and transplant patients. So, a pregnant female is affected, and this organism is given to the neonate by a transplacental route. So, what happens is that it affects various amount of cells. Now, how this organism entered those cells and cause its disease is that this organism consists upon a specific attachment point, which is known as internalin. Now, internalin attaches with each adherence of the cell. Similarly, it goes inwards, but as it goes inwards, it results in formation of a phagosome. Now, phagosome, normal its properties is that it combines with the lysosome and degenerates the material that has actually gotten in and take its protein that is actually needed by the cells and to form various sort of things. So, before the lysosome fuse with this phagosome, it secretes an enzyme known as listerolysine. Similarly, it fastly escapes from this phagosome and is not digested, and it can similarly survive within the cells of the organism and cause its various disease-like properties. Now, the beautiful thing about this is that it can go from cell to cell. Now, going from the cell to cell is by specific actin rockets which launch them from one cell to the other cell, and similarly it affects other cells as well, and it is not destroyed in the process by various antibodies, neutrophils, and macrophages. Now, what clinical features this gives rise to? That in the neonates, it will cause meningitis. In the newborn baby, it will cause meningitis, inflammation of the meninges, but it is caused after 1 to 4 weeks after the birth. In mother, they are mostly sometimes asymptomatic. They have influenza-like symptoms, but if she is pregnant, this baby can die. So this leads to also abortions. Now, the gastroenteritis, which we are talking about, that the patient develops watery diarrhea, accompanied by vomiting and abdominal pain. Now, the gram stain for laboratory diagnosis of this organism is that we can use a gram stain. On gram stain, we can find the L-shaped or V-shaped organism, which is a gram-positive rods. And on culture or on blood agar, what we see is that we can see a narrow zone of beta hemolysis, which gives its firm diagnosis, and it's tumbling like motion, which helps us to differentiate from Corynebacterium diphtheria. Now, as we know, this organism actually causes specific diseases. It can cause diarrhea, meningitis, and sepsis. So, the meningitis and sepsis is actually an invasive disease. So, we need to have a specific types of drugs, which is the drug used in this is trimethoprim sulfamethoxazole. Now, this is also given in transplant patient because it also prevents against a specific dangerous organism, pneumocystitis pneumonia, which is in which the transplant patient is most susceptible to. So this also covers against Listeria and this organism. So it's mostly given to transplant patients, and we also can give it to the female patients. Now, the other thing is that we can use this, or we can use ampicillin or gentamicin in combination, or we can use ampicillin and trimethoprim sulfamethoxazole along with that. So these are the various combination of drugs which can give to the patient.